Hi
guys,
guys, welcome to
welcome
our live
to our
chat.
live chat. Tune in with Ran and Dave. Let's unzip a topic. I'm Ranjini.
And I'm Devapriya, and today is going to be our episode number 20.
20 guys, yes, 20. Yes, it's been a wonderful 20 weeks. Coming live just to share a lot of informative topics to you guys. And today marked our 20th week. That's amazing. I feel so excited. How about you, Priya?
I'm so excited, and the MCO is still on. I don't know when it's going to finish. I'm really
Uh-huh.
hoping that it's going to finish very soon. And
Uh-huh.
as usual, today we got another fantastic topic which
Yeah.
will be very beneficial to our audience. So,
Yes.
without further delay, so Ranjini, please do the sharing session.
Okay, so as usual, I'm gonna share the screen. So it's our usual thing. All right. Okay, so this is our logo as usual, and this
Mhm.
program is powered by MindApps, Malaysia's best online learning platform.
And you guys can access my apps whenever you want with the links provided in the screen.
Yeah. So as shared yesterday in our page,
Mhm.
today's topic is going to be something totally new to me, and I'm sure a lot of you guys going to learn new things, which
Mhm.
is what is OTC medicine. I myself
Yep.
wonder what is OTC medicine. So who are the panelists to bring this topic today with us, Priya?
So our panelist is going to be a very experienced pharmacist. She has been in this industry for past 9 years. So we very honored to welcome our panelist today, Mrs. Nadia Binti Hamza, a pharmacist. So without further
Okay.
delay, she's already here in the backstage.
Okay,
So
so I'm
let's
going to stop sharing. That's done. All right. Okay, I'm
okay.
ready.
So shall we bring her?
Yeah.
Okay.
Hi, hello
Hi.
Hi.
everyone.
Hi,
Hi,
Kanadia, first of all.
Hello. So,
How
are
are you
you
doing?
ready for our topic?
I'm
Yes, I'm
sure. I'm
ready.
sure the viewers are also ready.
Yes.
Yes, I am ready.
So
Okay.
first of all, thank you so much for spending your time to be on our show today at Saturday night. Really, thank you for that, Kanadia. By the way,
Yes,
I'm going to
you're
call you
welcome,
Kanadia.
Priya. I'm happy to
I
be
hope that's
here.
okay. Thank you so
Yes,
much.
you're welcome.
So, for the audience, if you guys have any question during the show, just type your questions in the comment box. So we will attend the questions at the end of the show. So without further ado, let's go to our topic today. But
Mhm.
before that, Ranjini, I just want to share
Mhm.
something that I came across just about few hours ago in my Facebook feed. So I just want to
Mhm.
share it.
Sure.
There you go. It's quite interesting, by the way.
Let's see.
Okay. So you guys can see it.
Okay,
Yes.
slowly. Yes, I can see it. Yeah.
Yeah.
So one of it is tranexamic acid 250 mg 4 tab per day to whiten your skin. And the person say good luck. And
Oh.
by the way, here another person feeling very worried. He put there vitamin C is ascorbic acid and tranexamic acid, which he mentioned here, is it's a coagulant for the blood. It's not for the whitening of the skin. But you guys can see here. I'm gonna stop my share screen.
Mhm.
So this is actually what's happening out there. People tend to misunderstand a lot of things,
Mhm.
especially when it comes to drugs, medicine, in whatever form, supplements or injections. So this topic is going to be really beneficial for all the
Mhm.
audience. So
Mhm.
without further ado, let's take
Yeah.
our first question. Are you ready, Kanadia?
Yes, I am.
Yeah.
Okay,
Okay.
first of all,
So
you are talking just now,
mhm,
the slide that we are looking at, which is tranexamic acid for whitening the
yeah.
skin. Actually, a lot of
Mm-hmm.
people out there are using this. It is actually a prescription medicine, which they
Yep.
shouldn't get from any community pharmacy. Uh,
Yep.
Actually, the lighten the skin meaning is actually the side effect of the medication.
Oh.
Okay.
Yes.
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 So when people know this, they use it for lighten the skin lah, which is obviously
Beautiful.
wrong. Yeah?
Okay.
Okay.
So we call it as a misuse of a medication.
Mm-hmm.
Yes,
So
it's a
yeah.
Okay, we can go. We
Okay.
can
So shall we take the first question?
more in depth as we go on. So maybe we can start with our questions. Yeah.
Yes.
So yes, our first question.
Sorry, you were saying, Kanadia?
Yeah,
No,
our first
you can
question is going
go
to
on to
be
your first question. Yeah.
okay. So Kanadia, my first question is what is we call as over the counter medication, OTC medication, and
Uh,
how a prescription medication different from it.
Okay, so over-the-counter medicine, as we call it, OTC medicine, is actually
Mhm.
a non-prescription medicine which we use to treat minor symptoms like we having a low grade fever, stuffy nose,
Mhm.
or even cough. In and it can be variety of condition, even from headache to stomach aches lah. So we need to note that that some of our OTC medicine do contain substances that are controlled under our Poison Act 1952 and can be obtained only after we consult our pharmacist or doctor lah. Okay, so
Mhm.
OTC medicine, why people really like it? Because there's no need for them to see a doctor and get any prescription. We just go to any of the community pharmacy, even 7-Eleven, to get our paracetamol, Panadol, our Gaviscon. Yeah. So how is it that
Yeah.
different? Okay, for prescription medicine, only will prescribed by the doctor. Over the counter medicine, in a way, we do not need a prescription medicine. And as I said, we can only get it from our pharmacy community.
So it's very how to say it's quite
Yes, Priya.
convenient for the people to get it from very nearby by
Very
their house. As Kanadia said,
yes,
even a 7-Eleven can sell some of this medication
yes.
like cough syrup or yeah, Gaviscon, Panadol, and all those kind of things.
Hmm.
So, Kanadia, you need to let me know when I
Yeah.
need to share the slides so that I will do that. So, for the
Okay.
second question, Ranjani.
Okay.
So this is really getting interesting, guys, because I would say like I'm having two pharmacies here before me. Priya herself is also a pharmacy, so it's totally a learning ground for me. And I personally have
Assistant
a lot of
pharmacist.
questions, which are based on my experience. I've of course, I've purchased the OTC over the counter medicine. That's a very new term that I've learned today, and I believe for the viewers as well. So the second question is it's quite related to all of us, which is list out some commonly purchased OTC medicine by people outside there, especially in Malaysia. We can take Malaysia as an example.
Okay.
But
There's a wide variety of apa ni OTC medicine. Okay.
Mm-hmm.
Priya, maybe you can share the slide. Uh,
Sure.
okay. Yeah. Okay, so we have antipyretics or analgesics category of OTC, which this is very popular, Panadol, which we use to decrease our fever, relieve even muscle pains or muscle aches. Yeah, the example would be as simple as paracetamol and ibuprofen. Another very popular type of OTC medicine is our antacid, yeah, Gaviscon, which actually the active ingredient contains magnesium trisilicate, sodium bicarb, and aluminium hydroxide. Yeah, okay. And the next slide, Priya, if you can see, there's a lot of over-the-counter medicine. Even if you know in US, okay, they have like 900 OTC medicines, yeah, in US.
Wow.
In Malaysia, I think lesser, yeah, because we really control, yeah. Okay. We even have antiseptics or skin disinfectants, Dettol's, our
Mm-hmm.
Dettol, yeah, which
Mm-hmm.
we use to clean our clothes, yeah. It's actually one of the OTC medicine. We also have
Mm-hmm.
our locally acting lozenges, your strepsils, even
Yeah.
fisherman friend. This one all contain
Mm-hmm.
active ingredient, means it's actually a drugs which contain diqualinium menthol. Okay, we also have
Okay.
our counter pin. If you sakit bahu, sakit kaki,
Mhm.
we normally use our counter pin. This one is a topical type of analgesics or counter irritants we call it,
Mhm.
which we use for our muscle and joint pain. Dia punya active ingredient is actually menthol, camphor. So we have a very good smell when we use our counter pin, right?
Yeah.
So as simple as Wicks, Wicks nasal inhalers. Also,
Mhm.
one of the OTC medicine which contain
Okay.
menthol, camphor, which the category is a topical nasal decongestant lah. Okay.
Mhm.
Interestingly, our anti-dandruff, the shampoo that we use untuk kelamomo, yeah,
Mhm.
our Selsun is actually contain coal tar. This one also is our OTC products, yeah. We
Yeah.
also have oral care, or
Mhm.
even our anti-acne. Priya, kalau muka naik jerawat, we normally use
Yes.
our Oxy 5, yeah,
Yeah.
Oxy 10. All
Yeah.
this actually over-the-counter medicine, which means dia memang ada drugs inside,
Okay.
which normally our salicylic acid atau even benzoyl peroxide. That's why nama dia Oxy, benzoyl peroxide. Oxy is come
All right.
from there lah. Okay.
Okay.
We also have our antibacteria also lah. Okay.
Mhm.
If you go for the next slide, Priya, this
Mhm.
one we can see lah all our OTC products here,
Features.
our
Mhm.
anti-acne, our anti-dandruff, even our strap seals, our as I said counter pain,
Counting.
betadine, even thymogravils, yeah. Okay, all
Yeah.
this is the example of the OTC products which we can get in
Okay.
Malaysia. Mm-hmm.
Actually, that's quite is there any? Okay, that's actually quite a number of, but I don't know if this is going to fit into any, but like for an example, how do we know a medication actually need a prescription? Do we have that in any questions later, Priya?
Yes, when we talk about the categories, I think it will fall under, some will fall under prescription medication, some will fall under traditional medication, some will fall under over-the-counter medication. I think Kanadia gonna touch that part
All right.
later, but it definitely gonna answer your question. So
Yeah.
as we saw just now in the slide, that I bet that is most commonly purchased medications by ourselves even. So all the
Yeah.
Dettol, oxy
Yeah.
creams, the counter items. So these
It's
are
quite
very
a shocking
familiar.
thing for me when you say anti-dandruff and also Dettol
Yeah,
is actually like okay, it's what contains drugs in. Okay, I think we can move to the next. I think I will shoot that question later during that
sure.
relevant question.
Okay, our third question sounds like this, Kanadia. So, is
Yes.
there any precautions one need to follow when they self-treat themselves with the OTC medication as what you mentioned just now?
Okay. There's a tips for us to follow lah when we
Mhm.
actually self-treat ourselves with OTC medicine. First
Mhm.
of all, this is very important for us to always consult our doctor or pharmacist even if we purchase the OTC products. I believe a lot
Mhm.
of community pharmacies now have one dedicated pharmacist in their store, which will help us to get information regarding the OTC products that we are going to purchase. Yeah. So as I said, the first
Mhm.
one, okay, Priya, you can go to the slide. We should consult our doctor or pharmacist. Secondly, we
Mhm.
need to keep a current list of medication that we take, because this is very important, because only our doctor or pharmacist would know what is our illness, what is our current situation, whether we have any allergics to any medication. So if we have any allergics, then maybe our pharmacist or doctor should recommend other type of OTC medicine which is suitable for our condition. Uh, Thirdly, after we bought our
Mhm.
medication, we should always read the labels carefully. on how should we take the medication, when should we take the medication, and how frequent we should take the medication. The labels also will be important because it will tell us what is the a precaution that we need to take, or warning, or any important notes for us lah. Okay, fourth, we should only use the measuring device that comes with OTC product. I believe that if we have children in our house, we bought paracetamol or Panadol in the community pharmacy, we go back and we will like, you don't know what is the dose, when should we give the medication to our children. So and what type of how many meals should we give, all that we need to read. And if they give the intended measuring cup, you should only use that. Jangan guna our spoon at home and all, yeah.
Yeah, estimation. Half spoon
Yes.
or quarter spoon.
For the children. Okay. Then we also need to check for expiration date for our medication. Normally kita beli tu ubat batuk dan sebagainya. Even ubat batuk cap ibu dan anak is actually OTC medicine, ya. Okay, for your information. Okay, like kalau kita beli ubat batuk ibu dan cap ibu dan anak, then we bought it 4 years back and we didn't realize that the ubat tu sudah expired. So very important for us to check the expiration lah. Okay. And then the last one, most importantly, if you are pregnant or if you are a breastfeeding mother, you should always consult with your doctor or even pharmacist lah before you take the medication. Okay, because we do not want any harmful effect to our babies. Okay.
Yep.
Okay.
So
So,
that's on the
yep. We call it as a teratogenic effect.
Yes.
Am I right, Kanadia? I hope I'm right. So teratogenic is when you consume medication, if it can pass through the placenta of the mother and can go and affect the baby, we call it as a teratogenic medication, which the pregnant mother shouldn't take when she is having a baby in a womb. So
Yes.
that's why it's very important to speak out and tell the doctors what is your condition actually before you consume any medications. So that's about it. Very well explained. Thank you so much.
just to slide in one question, can a pharmacist actually prescribe medicine?
No, pharmacists shouldn't prescribe any medicine. In
Okay,
Malaysia,
I don't have
no.
the power.
No, we don't have the right to prescribe medicine in Malaysia. It will be
Okay.
different in other country like United Kingdom and all. But in Malaysia, we are very strict. Only doctors can prescribe medicines. Which
The reason is like we do
which means
have. I'm sorry. Like the reason is we do have pharmacists. Sorry, am I lagging?
you may continue.
Okay, sorry. So you were saying, Kak Nadia, sorry.
Yeah, I would say that if the medication prescribed by the doctor, we consider as a control medicine, which means only doctor can prescribe the medication. Yeah, you may continue, Ranjini.
Okay, sorry. So the reason is like I have experienced. I have encountered a pharmacist actually who prescribe medicine, like, but I don't know if it is actually it should be blamed to the person who go and approach them, or how. Like, for example, I have experienced going to a private pharmacy, and then like I just go to the counter and ask like I'm looking for some a medication for skin allergy, and then they will be suggesting a few. So I wonder if that's right. Is that how it's supposed to be?
Okay, sadly, there's a lot of pharmacies out there giving medication without prescription, which is strictly very wrong. You can actually go and buat aduan lah to biro because it's a wrong thing for them to do. Maybe they are trying to make a profit out of your problem. But if it is a prescription medicine, means all the medication should be behind them di dalam almari berkunci. Apa-apa ubat yang kalau you pergi to private pharmacy, if it's behind you, there's a cupboard which is locked, panggil almari kunci, that one is a prescription medicine. meaning to say if the medication you want they took from the almari, there need to be a prescription.
That means I
I
need
believe,
to tunjuk the
yeah,
prescription from a doctor lah kan? Okay.
you yourself need to give a prescription to the pharmacist, then
Uh-huh.
only the pharmacist can give you the medication.
Okay,
A
okay.
valid prescription. That is also
Yes.
very important.
So why
Yes.
is that a valid and non-valid? Is there what how do we differentiate that?
Okay,
Yes,
sometimes you
Kanadia.
have a family friends which is a doctor maybe, and then they will like, okay, you sakit ini, I will write you on one piece of paper and they give to you, and maybe you can go to a private pharmacy and ask for the medication. That one is a non-valid prescription.
Oh,
Where else, if it's a valid prescription, meaning to say you already went to see a doctor, that's a prescription
examine
which
that.
right what kind of clinic, hospital, what is the medication, even the dose, when to take it and all, then only you give to the pharmacist and they should give you a correct medicine.
Okay, okay,
Yeah.
that's a lot of things. Okay, because like what you were saying just now, like if you have a doctor in family, then you ask, and then okay, we sort of know because some of the parents, especially based on experience, they went and see a doctor, and then they prescribe, let's say medicine A, and then for the next round when it finishes, they go and buy the they don't know the name and so on, so they go and buy in a private pharmacy. So that's considered not right, is that?
No, it's a wrong thing to do.
Okay, okay, I understand. So I guess for the viewers, I think this will be a very, very informative session, especially for the parents. And I believe most of you guys are doing this, the example which I just told. So maybe it's time for you guys to watch this and do share this stream to any Facebook pages or platforms so that the others also can benefit from this very, very useful session. And it's totally new to me as well. So we are moving on to the next question, Kak Nadia, on do people need to inform the community pharmacists if they are under treatment of any prescription medication by a MO? I think, and why actually? Maybe we have
Okay.
touched on that. So, yeah.
Yeah, we actually already touched a bit of it, but yes, OTC medicine. What is important is our OTC medicine. If we take it without consulting our doctor or even pharmacist, it can cause harm to us because the existing prescribed medicine may interact with each other. So, especially, I have to say, especially for the elderly, for children, for pregnant, breastfeeding women, this is dangerous things to do. Uh, when we combine these two, OTC and the prescribed medicine, we always need to know whether the patient have any allergics to any of the medication that they are going to take in the OTC medicine.
Mm-hmm.
Patient which have a chronic disorder also need to consult their doctor or pharmacist before buying any OTC products.
Mm-hmm.
Because you need to note that our OTC medication is not for serious disorder. So if it's the pain that you have is serious, it is I believe it is important for us to just go to the doctor and get a valid prescription and take the medication from hospital or clinics lah.
Mm-hmm.
Okay. Normally, if we take OTC products together with our prescribed medicine, if they cause some rashes or even insomnia, we just need to stop the OTC medication and go back to our doctor and have a look on what should do next lah.
Okay. So that's quite interesting. And one more thing, Kanadia, I see some of the elderly people, even though they're taking the prescription medicine, sometimes they don't know what is the name of the medication. Because elderly people, they just know it's brown, it's white color. So
Yeah,
usually, if they want to elaborate like that, for us, being in the pharmacy industry, round and white color tablet is a bunch of thousands and thousands of tablets are round and white
yes.
color. So it's very difficult for us to actually recognize which tablet actually they are taking. So for those kind of people, what will be your advice when they go and purchase any OTC medication? Perhaps did
Okay.
they need to bring sample of medication that they're taking, or how?
Yes, if they are going to buy any OTC medicines, and obviously for elderly, they cannot even remember what kind of medication they are taking. Sometimes when
Yeah.
they are taking anti-diabetic agents, medication, they are saying, oh, saya sakit, I'm taking maybe cholesterol medication, which will make the pharmacist confused. So first of all, maybe they should list down the medication that they are taking now,
Mm-hmm.
and it is a good thing if they bring the whole bag of their medication in front of the pharmacist in the community pharmacist for the pharmacist to have a look, and so that if they want to buy any OTC medicine, the
Mm-hmm.
pharmacist would have to take a look of each and every medication they are taking, and then suggest the best OTC medicine for them. It's
That's right.
okay for
That's
them
right.
to bring the whole bag. Yeah.
Yeah. As long as we can see and recognize the correct
Yes.
medicine before
Yes.
they use any other medications, because
I
obviously we
believe
do not.
even I believe even the adults, right, if they go to the community
Mm-hmm.
pharmacy, if they want to
Mm-hmm.
buy ubat sesama, and they go like, saya nak ubat kuning yang mengantuk tu. Okay, which is our Piriton. Yeah?
Chlorpheniramine. Yeah.
Again, Piriton is a prescribed medicine,
Yeah.
which sadly a lot of community pharmacy which jual sahaja lah. Okay.
Mm-hmm. Mm-hmm.
But
That's right.
why is it like if it is a like sort of like prescribed medication, why is it like still being available? Like some of the brands that you mentioned, we mentioned in the earlier part of the show. Some of these shops or yeah shops still selling it. Like how is it? And I don't know if it's like because sometimes to be honest, like I do not know what are the list of prescribed medicines and what are the one that you can just go and buy because like, I'm a layman and I have got no background in this. So usually when I go and see like and like it's been like a practice also like from your parents' time that you know if you have medicine you go and get the it's a very famous name for it this woods. Yeah.
Ah, okay.
Woods. I don't know
Which
if it's
is
a
Dr. Matu.
medication. That is
Okay.
over.
Okay, if you enter a community pharmacy, okay, you will see a lot of shelf, yeah, okay, in front of you. And then normally all the shelf will actually jual all the OTC medicine, while the
Mm-hmm.
control or prescribed medicine will only be at the back of the pharmacist punya counter, dan dia dalam almari berkunci. That one
Mm-hmm.
is a control medicine. If you go to the pharmacy and then you request for a medication, then the pharmacy goes straight to the almari berkunci and buka and give it to you. That one is wrong, meaning to say that one is a control medicine. But if they go at the shelf and recommend you like Woods, like Strepsil, or even Diflam or all that, okay.
Oh,
But
okay,
if
okay, okay. Wow,
yeah,
that's really new because I've been experiencing this and I thought it is okay. Actually,
no,
like
it's not
I
okay.
think in many pharmacies and they like just open
No,
the
actually,
almari. Yeah, I thought it's okay. I really thought
It's
it's
not.
okay. So now, guys, I guess like if any one of you guys
Mm.
okay.
watching similar like me, it's not okay. It's supposed to be a prescribed medication, which means you need to you know show your prescription from a doctor before getting medicine from their side. Wow. Okay, that's fantastic.
Mm-hmm.
I guess
Yeah.
we're gonna move to the
Very true.
next question. Yeah, yep. But before that, for the viewers, if you have any question
Yes.
regarding this topic on over the counter medication, you can type that in the comment box, and we will direct it to Kat Nadia at the end of the show. And moving on to the
Yep.
next
So we
on
move on.
question number 5, right?
So
Sorry.
I'll take
How
the
to
question. Yeah.
identify whether
Sure.
the medicine that we purchase over the counter are registered under Ministry of Health Asia? Did we touch on that?
Okay. Okay, Priya, maybe you can go to the slide. Okay. For your
Yep.
information,
Yep.
ya, Ranjini, especially Priya mungkin sudah tahu banyak. Okay. In Malaysia, all medicinal products must registered under our Kementerian Kesihatan Malaysia, Ministry of Health. Yeah, meaning to say, tak kisahlah that one is imported from France, even India. If they want to be marketed in Malaysia, they need to go back to step one, registered. And go and register with our Kementerian Kesihatan Malaysia. Because why? In Malaysia, we are very strict. We want to guarantee all the safety, quality, and the efficacy of our medication, which is available in Malaysia. Thirdly, which is very important, all medication which is registered under our Kementerian Kesihatan Malaysia will have two things here for us to remember. The first one is the registration number, which start with MAL for Malaysia, and the 8 digit numbers belakang tu, and will end with one alphabet lah. And also the secondly, we should have hologram labels. Okay, Priya can go to the next slide. Okay, if we realize there will be a alphabet at the end of the registration number. A for the control medicine, for example, our parents' hypertension medication.
Antibiotics.
Antibiotics. For example, our antibiotics apa ya? Cloxacillin,
Augmentin,
our
proxazolone.
our anti-diabetic like metformin. And X is for our topic today, over-the-counter medicine. So if you want to know whether the medication is OTC product, they will have X. Yeah, Ranjini?
Yep.
Okay, for all the traditional medicines, the herbal products, natural products, they will have T. For example, like apa ni? I think brand yang agak famous macam apa ya?
Tokat Ali. Kacip
Ya,
Fatihah.
ya.
Is that
Ali.
medicine?
Ada di dalamnya the active ingredient is tongkat Ali lah, Priya.
Oh, okay. Okay.
Mungkin nama dia tonic or power kopi ke, I don't know. Okay, so the
Kopi
next,
jantan.
okay, that one is into the another category lah, food punya category, but this one for traditional lah, traditional medicine, all your jamus ya, jamu makan, orang Melayu makan kasih Fatimah memanjakan on all that. Jamu mesti registered, must be registered, and yes, dan belakang dia ada T tu, which means they are registered. And for health supplement lah, you pergi beli Blackmores, our calcium supplement, your cod liver oil, and all that will have N lah. H untuk animals. Okay.
Okay. A question. Sorry, sorry. Did I interrupt? Sorry.
No, you can continue.
So I have one question. So when we speak about these medications, right, this is getting interesting because I'm like flipping back to my experience back then. Okay, I love to go to pharmacies. Pharmacies not, I don't want to name the brand. Like, you know, sometimes I do go to pharmacies for shopping purposes. So where like you do have sorry, is the okay. You do have medicines like as you said, like at the back of the cupboard, and then it's locked, and you need a pharmacist to be there, otherwise you can't purchase. And at the same time, you do have something like as you said, Blacksmore, fish oil, and then maybe all these types of things. They call it supplement. Sometimes it's in a powder form. Sometimes it's in a tea form. Actually, like for an example, there's a slimming tea or something like that in a tea form. So are these all? How do we, like as a layman, when we go? How do we know? How do we like differentiate which is actually, you know what I mean? Like is it safe and sound for us to consume just by buying it with the thought that if it's in a pharmacy, that means it has to be safe?
As I said, if you want to buy, if you have a doctor, then consult with your doctor. If there's a pharmacy in a duty, ask them what is their suggestion, what is their recommendation. Because sometimes you think that you need a supplement, but actually you do not need the supplement. So I think it's best for us to always go for pharmacy or doctor and get guidance lah before we bought all these even supplements.
This is really very interesting because I agree. Like throughout my experience going to pharmacies, most of the time they will come and recommend this supplement is good for you and so on, and like it is good for if you are focusing on this. Like especially if you're on omega 3, then they will suggest a wide variety brand of fish oils and so on. So this is something really interesting to me. And how about medicines which we apply on the skin, not we don't consume it, but we just apply it on the skin? Is it also fit into the categorization as you shared earlier?
Yes, if it's OTC medicine, normally it is safe, but again, depends.
Okay, all
You
right.
need to consult.
This is really okay. Yes,
Yep.
thanks so much for the explanation. And for the viewers, if you have any question to Kat Nadia, you can type that in the comment box about OTC medicine, and we will direct it to her at the end of the show. So moving on to the next, Priya.
Yep.
Okay, before that, the slide showing you a sticker. That one is our hologram sticker. This
Mm-hmm.
one will have on every registered medication, and this will help us to actually know whether our medication is actually genuine. Ya, so kalau ubat tu adalah ubat tiruan, kita boleh check di mana itu di the next slide ya Priya, which is we have
This one is it?
if you realize, right, if you go to any community pharmacy, we have this Meditech decoder, which helps us to check lah whether our medication is genuine or not. We just put our hologram, okay, on that card, and dia akan tunjuk lah whether ubat tu actually ubat tiruan ataupun ubat yang asli. I
Mm-hmm.
believe a lot of fake apa ni medication is out there dijual dengan harga yang murah, and it is very disappointing.
Yep.
Yeah, I understand. Yeah.
That's true. That's true.
Another question on cosmetics. I don't know if
Yes.
cosmetics actually fits into this drugs category, or what's your
No. No. Okay, for
Mm.
cosmetic, kita ada lagi satu kategori of registration. We call it as notification number. For
Mm.
medication, it is MAL number. While for all the cosmetic item, they will have also a registration number which start with NOT, notification, NOT, and they will have a number there.
okay?
Mm.
At
That
the
means that is already approved by KKM. Is it
Ministry
that?
of Health. Yes, yes.
Okay, okay.
Uh,
All right. Okay. So
because
that's
kita dah check, I believe that a lot of women out there love to be beautiful, their skin, they want to be lighter. Okay, so kalau mereka guna kosmetik yang mempunyai apa ni item-item terlarang like steroids, like
Mm.
mercury, which can harm their skin. So that's why it is important for us to see whether there's a notification number on the cosmetic. I believe
mm-hmm.
there's a lot of online medication out
Yes.
there yang kata mereka dapat kelulusan tetapi sebenarnya is a fake cosmetic or even a fake notification number. So that's why we can always go to our pharmacy website which is NPRA and even MediQuest to have a look whether
Yep.
this cosmetic or medication really registered under our Kementerian Kesihatan Malaysia.
Okay. Sorry if it's too much for me, but I just have another one question. So, let's say some people they don't opt for this. Seeking doctors' advice and so on, but they instead they go for traditional options. So, like for an example, we have Ayurvedic for Indians, and I'm sure there are more options for many other races and so on. Like yeah, it can be many. So my question is like sometimes when we go and seek for an example based on experience, seeking an Ayurvedic what is this advice at this practitioner, and they give some sort of medicine, and they said this is from natural things and so on. Is that type of medicines need to be in Malaysia? Is it need to be approved by KKM as well?
Yes, it needs to be registered for natural products lah. So dia akan ada T kat belakang tu. If it registered, then okay. I believe like Himalaya products also based on Ayurvedic products, right, Priya?
Yeah.
Kan? So
Maybe
Not
if
100%. They are actually commercialized also. Yeah.
yeah, if it's commercialized and they really go and registered, then I believe it is safe. Because what we afraid of is normally when we call it as traditional medicine, cosmetic and all this, they tend to add on all those very dangerous ingredients inside the medication or even cosmetics.
Yeah, yeah.
Mhm.
Such as bleaching
Yeah,
elements, mercury,
yeah, yeah.
to
You
name a
kata you
few.
sakit lutut, then you pergi to the practitioner, then dia bagi you satu bulat ni ubat and give it to you, and you don't know whether actually inside got
What's
steroids. So memang
inside? Yeah, 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 yeah.
yes,
yeah, what's inside is very important.
Exactly, because it's going inside you. All right, but
exactly.
I guess if we the consumers still opt for this sort of traditional medication without the registration with KKM, I guess it's as good as to say that you're taking a risk. Am I right?
Yes.
At
Yes,
your
yeah,
own
taking
cost.
risks.
At your own cost. So for you guys who have been like, maybe a few of you might be watching this now or later, who are consuming medications from these traditional, medication practitioners, then perhaps you can actually request to them to check whether they actually have certain the T in their registration or not, so that it is actually truly safe for you to consume. And I guess yes, that's fabulous. Really nice to hear so many new things, and I guess it will be a guidance for me to be more cautious in future, I would say. And I guess Priya, we can move on to the next
Yeah,
question, I
before
guess.
that, I just want to add on.
Sure.
So, did you realize, Ranjini, sometimes when we people get their medication from an outside pharmacy, a retail pharmacy, perhaps,
Mhm.
they might give the tablets not in a blister packet, just enter inside a envelope like that. And sometimes they don't really wrote the name of the medication. They just write the ubat demam, ubat gatal, ubat sersema. But the right way to do a label for the medication, any medication, is to write the generic name of the medication itself, the original name of the medication.
Uh-huh.
Without the name, if you get any medications from any pharmacy or any place without the name of the medication and the expiry date and batch number, if can, of the medication,
Uh-huh.
actually they can ask the people to write the name and expiry date and batch number on it, because that is the most important detail any medication envelope need to have.
Okay, okay. So that's another information also. But
Yes,
something crossed my mind and it just went off when I was focusing to it. Like, I really hope that I will be able to
you will get
recall.
it back.
Yes,
Okay,
we
we
can
go
move
for
on to
another
the next. And
question.
I have a few more questions coming up. So yes, over to
Yes.
you, Priya.
So, Kanadia, as you said, you have been a pharmacist for the past 9 years. So, as we know, the elderly and the children are more vulnerable to any kind of side effects from the medication. So, as a pharmacist, what will be your suggestion or your advice to the parents who wants to give an OTC medications to their children?
Okay, first of all, if you have children less than 2 years old, okay, never ever give any over the counter medicine. Okay, without obviously without consulting your pharmacist or doctor, because this is very dangerous. There is a risk of life threatening side effects. So remember, less than 2 years old, OTC product don't give. Okay, secondly, even for elderly, yeah, it's a no there. Okay, read the labels, because they will give the medication, with an instruction. So for children, the dose is very important. How many meals should we give to our children? Kalau kita ada 2-3 orang anak, satu umur 6, satu umur 2, and the dose will be totally different. Okay, so we have to give If the medication is for Ahmad Adli, then the medication should be only for Ahmad bin Ali. Never take the medication and give to the someone else. Okay. So for our children, the dose should be for our children based on her age and also her weight. Berat badan sangat important for medication for children. Okay. Satu lagi, never ever use our kitchen utensils. Rumah ada, walaupun mereka kata satu sudut teh, our satu sudut teh in the kat rumah is actually very different with the measuring spoon or even measuring cup given together with our OTC products. And then before we give our medication, the OTC medication to our children, make sure that there is no allergic. Make sure that anak kita tak ada allergic to apa-apa ubat lah. So that kalau kata terbagi nanti jadi masalah lah. Okay, and this one is very important also. Make sure that the medication that we give, the OTC product, is children formulated. Jangan bagi ubat batuk dewasa kepada anak kecil sebab the dose will be totally different. Jangan bagi ubat demam orang dewasa kepada kanak-kanak sebab the dose will be totally different. For children, there's a specific dose based on their age and again their weight. Weight is very important.
That's right. That's right.
Yep.
Because
So,
there have been cases like people use the ubat batuk untuk dewasa for the children, and the effect of the sleepiness, right? Because obviously ubat batuk
Yeah, it causes drowsiness.
It will
Yes.
definitely give huge effect to the babies or the children, especially below 2 years. You can't give
Yes.
any sedative medication to kids.
Yes,
So
yes.
I don't know how many of the parents knew it. So I think this is the time to take a precaution on that. And one more, Kanadia, how about this medications like IMO, eye ointments? Some parents, they just sakit mata is something like if one kena and then the second one definitely will kena one, because children are like to play around together, right? So when they using this eye ointment or something like that, can they share because both having the same problem?
No. Okay. They cannot use or share the same medication. If there's a two-person in the house, I mean two children having eye sore or eye illnesses, meaning to say they will need to have two medication yang berbeza mengikut nama masing-masing. Obviously, for less than 2 years old babies, they cannot use certain types of eye drops or even eye ointment, which can cause very serious side effects. Priya, you also know this.
Yeah.
For example, our CMC ointment, prophenicol. Ointment cannot be used for less than 2 years old babies lah. Okay, so kalau ada dua orang yang sakit, as simple as we need to have two medication. Cannot share. Why? Because satu orang dah sakit mata, and sometimes when we drop on the eyes, terkena infected eyes tu, then you another person, then yang mata tak sepatutnya merah pun akan merah lah, because actually it transfer the bacteria from one person to another person. So that's that.
Okay, fantastic. So I think we have been live for the past 48 minutes, actually close to an hour. So for the viewers, if you have any question to Kak Nadia regarding over-the-counter medicine, you can type that in the comment box. And we are moving on to another question to Kak Nadia, which is like, who actually regulates or go and do this inspection to those who have, illegally in a way or unauthorized people who sells this controlled medication? Is there any particular body? That's number one. And number two is how we as a public can actually do when we encounter this sort of situation. What is our role like in this situation? To you, Kanaria.
Okay, for the first questions, we maybe you didn't realize, or maybe you always think that pharmacies only work in a community pharmacy, in a hospital, or even klinik kesihatan. But actually, pharmacies has a very big and wide scope of job, which means we as a pharmacist also have our own scope, which means we work in an enforcement atau biro pengawalan pharmaceutical sebagai enforcement person lah, enforcement pharmacist. Kita ada biro kita sendiri. We go and raid all this premises lah, which jual barang-barang terlarang atau barang-barang yang tidak berdaftar dengan Kementerian Kesihatan Malaysia lah. For public, we always can go to the website for Biro Farmaceutical Pengawalan Farmaceutical Negara and buat aduan jika we have any complaints or problem lah with our medication. Or you realize that when you bought a medication, it is not registered and you feel scared. Maybe you have taken a fake medication or something like that. You can always go and buat aduan.
Okay, that's really very informative. So the Biro, I would say that's a Biro Pengawalan Pharmaceutical.
Pengawalan pharmaceutical.
Okay, so that's so this is what we as a public can do, if at all. I mean, if everything is going good for us, I guess this is how we can also together contribute to control this sort of unauthorized selling of medication. Because if I don't join this sort of discussion today and didn't bring this sort of topic, I'll be continue buying this. I would say prescribed medication, supposedly in pharmacy and without seeing doctor. This is something new, and I guess from here, I believe if you do your part, if you encounter any sort of situations where people who are not authorized selling any suspicious medication without any label or what, I think we can bring this to the Biro Pengawalan Pharmaceutical. So that's perhaps something that we can do for a better and quality environment in terms of when we purchase medication. So I guess Priya, anything
One more
to add?
question. Yeah. So usually when people buying OTC, yes, definitely it's convenient because it's nearby, it's easy access. So when someone taking an OTC medication and they experience any kind of side effects or unwanted effects suddenly, what they should do? And should they be panic? So what's the first thing they should do?
I think everybody will get panic if they take any OTC medicine and get a side effect of it. So I think the most importantly, if you have any side effect, any problem with the medication which you are taking, then just go to see a doctor.
A doctor. Okay. The reason is actually I don't know, because like if you scroll through like if I scroll through Instagram, and then there will be like all these dropship people selling this whitening at your armpit or whatever, and then or this vitamin C. It's really very famous. Yeah.
The body slimming thing.
Yeah,
Body
slimming slimming is definitely on top of everything, and then comes the whitening, and I guess like so many things like openly being sold in Instagram. Not only Instagram, sorry to say, like it can be in any platform or any websites and whatnot. You can even get WhatsApp selling this and that. So I wonder if we should actually, what should we do? Like if we encounter this, but what are the steps that we need to do when we encounter this sort of thing? And let's say I have an intention to buy a specific product.
Okay.
Maybe
So, for example, if you want to buy a slimming product, okay, first of all, you have to go and ask the penjual tu lah whether actually the medication registered under Kementerian Kesihatan. Sometimes they will say to you, this is all natural products, no need registration. Okay, if they say no need registration because it's a natural product yang membantu untuk kuruskan badan, then they should actually go and get a certificate from our KKM yang menunjukkan dalam mereka sudah buat chemical test. There's no harmful ingredients inside the slimming products, but I think for you to get slimmer is exercise.
Yes.
And take care of your diet, because I believe that every time they go and explain to you on how to take the products, for example, the slimming product, then they will tell you, okay, take this product half an hour before your breakfast, and then
Mm.
after take these products, please take care of your meals. Don't take makanan bergoreng, berminyak, minum air 2 liter and all.
Mm.
Actually, if you take the second option, I mean, all the 10 tips after the how to consume the medication, it should be enough to cause slimming for you lah.
Actually, speaking about the slimming, laxative is one of, let's say it, if I got it rightly, is one of the most famous thing when it comes to slimming, where you actually, and it really it really worked. Like people will be, I don't know, it will be start going to toilet, isn't it? Yeah, if you consume that sort of products, there's
Yeah.
a lot of products of that sort. I can see in Masjid India they'll be selling also at the corner. Back then, I do not know now. So, and then those are the things they do have labels sometimes. So I don't know. It's one of the things that, because the, I don't know if it's that action of, causing you to go to the toilet is the right thing or not. But again, oh yeah, this leads me to another question, which is, how do we know whether that the chop, or the marking is actually original or not? Because that is one of the issues, and that's how people mostly get make a decision wrongly, because they thought it's really qualified. So is there any tips for that?
Okay, as I said, you have to check whether it registered, okay, MAL number, and then they have the hologram labels, the sticker. You just go to any community pharmacy, have a look at the hologram. The pharmacist will tell you whether this one is a fake medication or is a genuine medication. Okay, talk about the laxative. Yes, it can cause slimming, but not actually slimming, because apa yang dia buat ialah dia buat kita buang air dengan banyak. So actually sangat bahaya, and it can cause dehydration and many other problems besides that. Laxative is for laxative purposes and not uh, for slimming purposes lah.
Laxative is
So
used.
this is how.
I believe a lot of people using laxative to cause slim effect lah.
Actually, laxative is used, what, to during before operation or
For
something? What is it?
constipation, perhaps.
Also for constipation. Constipation.
Okay, all right.
Yeah.
Understand. All right,
Yeah.
that's wow.
And
A lot of,
sometimes, yeah, before the operation, they want to clear the bowel.
yeah, before
Yeah.
operation they do give this, right? Yeah, I remember, because my one of my friends actually consumed it. So that's really fantastic. And we have a question from a viewer. Maybe Priya.
Maisara. So this is Maisara, my good friend. Just wondering, do you think OTC medicine is better than prescribed medicines? What is your opinion about this? Plus, people nowadays tend to consume supplements rather than seeing a doctor and get a proper management. Thank you for the question, Sarah. So
Okay.
it's hiding your face,
So
so I'm getting the question.
So do you,
okay.
okay.
OTC medicine better than prescribed medicine? Obviously, no. OTC products or medicine is meant to be for minor illnesses. Meaning to say, if you have a very, as I said just now, very low grade fever, then we can take OTC medicine. But if you have like fever for more than 2 weeks or even 3 days, you still taking your OTC product, that is something wrong for you to do, because you should immediately go to see a doctor, check for your blood, whether the fever is caused by the viruses or even bacterial kind of fever. So I believe we should only use OTC products or this OTC medicine for problem which can be solved immediately, and shouldn't be taking for more than 7 days, I believe. If after 7 days or even 3 days you still having the same problem, just go to see your doctor. For secondly, the question should plan nowadays. yeah, people tend to consume supplement rather to see a doctor and get proper management. Yeah, I believe a lot of people out there are more percaya kepada supplements compared to prescribed medicine, because they will have a mindset that prescribed medicine is racun lah, poison lah. Actually not lah, because prescribed medicine should actually solve your problem yang dah lama you hadapi lah, because normally we give prescribed medicine after we thoroughly check the patient, what is the problem, what is the diagnosis, then only we will prescribe the medicine. Where else the OTC medication memang akan cover wide range of pain or maybe like that.
Okay. So
I totally agree to that, because before the doctor prescribe any medications, there will be a long list of medical report. They need to check the creatinine clearance, the blood, the BBC, the RBC, and all the things which the laymen won't understand. But
Yeah.
there will be a thorough check after before they prescribe any medication. So I hope they don't need to get scared of seeing a doctor and get a proper diagnosis before they get any medication. So because we don't have any question yet, right? So I just want to share my screen to the NPRA's page. I think will be beneficial for people to see. So this is the official page of National Pharmaceutical Regulatory Agency. We call it NPRA. So when you go to their website, hold on. So here there is a slot where we can report any side effects or medication or vaccines that people have seen. And then product search, you can search whatever products that you want to see whether it's registered under NPRA or not. So for the consumer section, you can see, so the product search, the vaccine lot release, and also some of the medication which is already in the market, but sometimes they will be called back. People. Oh, sorry. I just want to remove it. Okay. So some of the medication will be already in the market, but sometimes, as Kanadia says, some of the enforcement officers will go randomly to any shops and pick some of the items as a sample, and they will do another laboratory research on whether is it true they did not really add on any unwanted material into the product after they get kelulusan from NPRA.
Marketed.
So they will do a
Yeah.
recheck. We call them as people. Oh, I can hear my voice back. So if they found out that particular product contains any harmful substances, they will recall back the batches. So all those information you can check. You can check at NPRA's website and also Ministry of Health's website. So as a responsible citizen, I think when you consume something, please be aware of these latest news on, because we need to be really clear on that, because consuming something and it can give effect on your body. So to maintain a good health, please take note all these things. And yeah, do check out NPR's page if you need further
this is
information
website.
about this OTC medicine. Yes,
Okay.
you're correct. It's npra.gov.my.
Yep. Okay. So yeah, still under okay. And yes, thank you so much for Sarah just expressed for the good explanation. So that's been a very fruitful. It's totally new for me. It's something that I've been like didn't really pay attention. I didn't know there's like this sort of it has so many things at the back of it. I just thought like it's just a process of go to the counter and tell what you want and just get it, and without this actually created an awareness to me, and I believe it also had created awareness for people who are just like me or even worse than me, that there are things that you need to pay attention when you go to the to any pharmacy, to any place to buy the over the counter medications. So yes, Priya.
Yep. So I think this will be definitely very useful, very beneficial for all the audience. So this live session will be available in our Facebook page and also our YouTube channel. So if you guys find this particular slot is very interesting and informative, kindly share it to your friends or to your
Oops.
social media platform.
Okay,
Yeah,
so
I
we've
can
been
hear my
live for
voice
the
right now.
last 1 hour and 5 minutes, and it's been a wonderful, wonderful session with Kat Nadia, sharing so many things. Very insightful session, and of course from Priya as well. She's also a pharmacist, guys. So it's been a very
Assistant
fruitful
pharmacist.
session. Thank you
Yeah.
so much to both of you, actually, especially Kat Nadia, for spending your weekend night with us and sharing good things. And I believe this will create a new awareness among people who will be watching this later also. So thank you so much, Canada. So we can have a nice day, and maybe a few words from you, Canada.
Okay. So thank you, Priya and Ranjini, for having me in the show. I really hope that our sharing session will help a lot of people out there to know more about OTC medicine, and I hope your show will have more followers after this, and all the best for both of you.
Thank
I
you.
believe this is a very good things for you to do. I mean, for me to know Priya, I'm very happy that she can actually conduct a show like this. And I really want to say all the best to both of you. Thank you for having me here in this show.
Thank you so much,
Yay.
Canada.
Thank you
Thank you
so
so
much.
much. And
So
yeah,
we'll
that's
see you
Bye.
again later
thank
in
you.
another fantastic episode. So take care,
Okay.
Kanadia. Bye
All right.
bye.
Bye.
Okay, take care.
Thank
Bye.
you. So
All
that's about
right.
it, guys. Our episode 20 on OTC medications. That's really a wow, wow. And finally, we have a topic, especially very close to Priya on pharmacy.
Yeah.
Actually, I never really, had this thing to actually talk to you about anything of this sort, because you know why, I don't know what to ask. That's the thing, and it's a good thing that you actually had this thought, and to bring about OTC and over the counter. This is the very first time I'm hearing this over the counter medication. I was like, when you first said that
Mhm.
topic, like, what is this going to be about? Like, okay, so what I told myself is, I did study it a little bit, like right through what is OTC in Google, and I was like, wow, this is going to be a very good thing, because it's a daily. Sometimes it's daily thing, daily lives things in many people, but these are the things that
Yeah.
we overlooked. Like for example, I've been
Yes.
overlooking this sort of things as long as I can remember, because I just go and buy things without really checking. So I guess this is something really really beneficial for me myself, because I
Mhm,
put
mhm.
myself as a viewer as well in this today's topic. And yes, Priya. So for the
Yes.
next,
So as what you say, I hope the same thing the audience also will felt, because yes, as you said, this is a norm in our life which we're going through, but yeah, we tend to overlook. So I really wanted to bring this topic to
Mhm.
create an awareness lah, basically. So
Okay,
if they think it's very beneficial, then just share it. It will be beneficial for
amazing.
other people.
Yes.
So for the following week, we have another fantastic episode going on.
Yep.
But one more, I think Deepavali is around the corner. How is the preparation there?
Okay, let me tell you, let me be frank. Deepavali is just like about 2 weeks from now, and I have been
Yeah.
totally occupied with my work. I've been like having sleepless nights for the last week, I would say. And
Mm-hmm.
yeah, I soon it has to start at some point. So yeah, I'll start soon. How about you? How about you? How's it going?
Yep.
Is your muruku ready?
Yeah, here we have already started. Yes, it's on the way. I'm going to join them in very soon.
Okay. So
So,
his
yeah,
muruku
next
is in
week
the
we're going to
preparation
have a fantastic episode.
now.
Yes, yes, exactly. So, next week we will have an episode as well. And maybe for the Deepavali day, it's also falls on a Saturday.
Yeah,
So,
we'll
maybe
make
on
something
that
special.
day, we will be doing something special.
Okay, so
So,
we
that's
will
it
not
from us.
announce it now. Maybe along
Yeah,
the way we'll come up with something. Definitely, we don't want to miss you guys on Saturdays. Like Saturday, 8:30 p.m. is always a show time within us
yeah.
and you guys. So we will definitely bring a content for you guys on Deepavali Day. So I guess that's it for today. Episode 20.
Yeah.
Signing off. I'm Ranjini.
And I'm Devapriya. Good night, guys. Bye.